American Hospital Association Hospital Community Cooperative is helping hospitals from around the country to improve community health and eliminate healthcare disparities. Population health management has become a key component of the business model and care delivery strategies at most hospitals and health systems. Yet the challenges to getting the work done are great. It takes committed hospital leadership, strong community partnerships, time, resources, and building community trust. Although this work is just beginning, the initial results have been very encouraging.
AHA invited us to participate in this program. They heard about the wonderful work that MutliCare has been doing in Washington State around addressing health equity inside and outside of our hospital walls. And we thought it was a really great opportunity to continue expanding on what we are doing and do more purposeful work in our community to address health disparities. So the HCC program allowed us to do this by focusing on African American women in Pierce County to enhance or expand breast health education.
Getting the word out, getting the education out is very important. A lot of women don't realize that if you go for your screening every year, you have a baseline of where your breast is in your health. So early detection, prevention, and education, all three are very important to saving lives.
Efforts to try and improve screening are really important. That's part of this program. There's a fear of screening. There's a mistrust of the screening process and of healthcare in general that leads to diagnosing at a later stage.
We had the opportunity at the Carol Milgar Breast Center to provide the breast health training and equipped the CHWs with the training. We provide them with the resources, and so it's fun to see how they take our training and make it their own to educate the community.
Outreach workers are very important from the hospitals. They're the ones that are out in the community and can bring back the information to the hospital leaders. Citizens and residents are very excited to be a part of changing the dynamics of health issues in our community.
And I think the hospitals need to understand that you employ the folks that live there, you see the patients that live in the community, and it really needs to go both directions. It needs to have an open door atmosphere on top of having open doors in the community for folks to come and have those conversations and really build those collaborations.
We have a lot of resources, but we don't have all the answers. Even though we know where we want to go because we've listened to the community, how we get there may be different than how we imagined. So I think we have to be humble. We have to look at what folks in the community, what other partners are saying, what they have to offer, and look at building true coalitions.
We have reached out to about 300 women in our community. We also have found that, I think on average, about 20% of the women typically learn something new. They want to share this information with other women that are important in their lives. That definitely, I think, is a sign of hope.
It's really exciting to see how organizations like MutliCare have really invested themselves in this work because they understand the real impact that this is going to have in their communities.